Fox 17 News at 10 starts right now.
Our first story tonight examines the racial discrepancy in maternal mortality. Our Olivia Yatuma looked at how mental health plays a crucial role before, during, and after childbirth.
Research finds that black women have the highest risk of pregnancy-related heart problems in the U.S. According to the American Heart Association, black women can be up to 5 times more likely than white women to die from pregnancy-related complications. So since it's Black Maternal Health Week, I spoke with a psychiatric mental health nurse practitioner to raise awareness.
When we talk about black maternal health, we cannot really have that conversation without also talking about mental health.
Cyrita Drake, psychiatric mental health nurse practitioner at Sea King Psychiatry, says you don't have to die because of the disparities within the black maternal health world.
Why they are so susceptible to these things that are treatable is because when they go seek treatment, their presenting symptoms are not looked at or treated the way they should be.
The American Heart Association says compared to white women, pregnant black women are 45% more likely to die in the hospital, 23% more likely to have a heart attack, and 57% more likely to have a stroke. They're also more likely to develop heart muscle weakness and blood clots in their lungs.
Those numbers shouldn't persist that way, and the only difference is that black women have the higher mortality rates.
Pregnancy-related deaths among women of all colors in the U.S. has risen 140% over the last 3 decades, and cardiovascular disease is the leading cause.
There are some medical conditions that happen, such as preeclampsia or eclampsia, where they are at greater risk because of the blood pressure issues.
But Cyrita says one of the main things women can do is look after their mental health before, during, and after pregnancy.
No one should be dying because of maternal complications when they can be treated and they can be prevented, whether they are medical or psychiatric.
Cyrita urges all women who have been pregnant, are currently pregnant, or plan to be pregnant to utilize community resources available linked on our website. For now, in the newsroom, Olivia Yatuma, Fox 17 News.